We call this COVID-19 because actually there's lots of different types of coronaviruses. Some infect animals, some infect humans. I think off the top of my head, I think there's 7 different ones that can infect humans, the coronavirus. And they can cause everything from just like the common cold that we get, or more serious conditions, like there's a condition called MERS, which is found out in the Middle East, which is a very bad cough and respiratory problem. And we know about those, and this virus, the COVID-19, is a new one. So we as humanity, as the whole population, have never been exposed to this one before. Yeah, so I think probably like the umbrella term, for everything where our health, isn't optimal is disease. And then within that, there's lots of different types, and so infection would be one of them. And then within infections, like that's like an umbrella for some different things as well. And so you have infections that are caused by a bacteria, and that's when antibiotics work because they kill bacteria. And then you have infections caused by viruses, and that's what the coronavirus, is. It's one of those. It's a virus, so it doesn't respond to antibac and antibiotics because it's not a bacteria, it's a virus. So it's kind of virus, infection, disease. That's, yeah.
How would you then, when we're using antibac and soap and stuff like that, if it's a virus, does that work on it or not then?
Yeah, so the best thing to get rid of a virus that you've picked up on your hands, say that you've picked it up from touching a surface, or you've gone and touched somebody and you've got the virus on your hands, soap is the best thing for getting rid of that, because as you wash your hands with soap, the action of the soap dissolves the kind of, viruses don't have cell walls, but they almost just break down the virus, where antibac is to get rid of bacteria, and virus isn't. Viruses aren't bacteria. Now, the things that carry an antibac hand wash have things like alcohol and other bits and pieces that can get rid of viruses, but the really important thing is hand washing with soap, because we know that gets rid of the virus. And then the important thing is doing it long enough. So, you've heard it say, sing happy birthday twice. It's kind of 20 seconds where you will wash your hands, getting in between your fingers, getting into your fingernails, remembering to do your thumb. And that's the best way to reduce transmission of the virus from one person to another. It's not always been around, it's a new virus. And I think it's a really good question, and we don't have the answer to that now. There's a question about it being transmitted from animals to us, but actually that's a question that still needs to be answered. Where did it come from? So just like any cough or cold, or if you had the flu, the virus lives in like your spit, really, and so if you were to sneeze, if you were to wipe your nose, then the spit and the snot that's sitting on your hands, or if you've coughed into your hands, that holds the virus. And then what happens if you then shake somebody's hand, or if you put your hand down on a surface and the next person comes along and puts their hand where your hand was, there's a possibility that they get infected by that virus. That's why hand washing is really important. That's why they're advising you at the moment, to do a bit of an elbow bump and not kiss and not cuddle, because that just reduces the risk of passing it to each other. But it can't blow miles down the road. So that's the way it's transmitted. It lives on the surface, can live on a surface for a few days actually, and I think there's also a question about how long do we carry it before we get the symptoms, and we're studying this and we're learning about it all the time. My understanding is they're thinking 7 days before you get symptoms, but that might change as we understand it more. I think some people will not know they've had it. They'll be very mild. Some people it will feel like the common cold. Some people it will feel like flu, where they ache and they need to go to bed and they're coughing a lot. And some people get very poorly, where their cough's so bad it might even affect their breathing and they might need some support in hospital. And just to put that in context, because I feel there's some fear around if you get the COVID-19 virus, you're going to end up in hospital. No, at the moment, and you know, we're recording mid-March, I think on the 16th of March, out of all of the cases that we're identifying, only about 6% need that extra help in the hospital. So 94% aren't going to need that and are going to get over it. So we just need to hold that in context, and those figures will change as we understand more about the virus. It's a brilliant question, and we don't know the answers to those. So are we going to see, you know, long-term lung conditions having had it? We don't know. You know, this virus has only been around kind of, you know, 6-9 months, and we have incredible researchers in the UK who are looking at this and investigating it and following it, and information about it is coming back all the time. But it's too soon to say whether we're just going to make a good recovery and that's it, or if there are any further consequences of having had the virus. Herd immunity is something that we use for a lot of illnesses, from mumps and measles and rubella and typhoid, and where we immunise so many people, and therefore once you get to a certain amount of people immunised, it can't be passed around, and you can bring some control over who's exposed by it. So in terms of that phrase herd immunity, it's something that's been around for years and years and years, and it's something we've used for years. Is it the right way? Look, I'm a GP and that question's beyond my scope to understand. But I think for the UK, I want to reassure people that we traditionally as a culture have been great researchers. Like, we have some of the best epidemiologists, so people studying infectious diseases and the spread of diseases in the world. Like, we send people all around the world over the decades to support outbreaks. And so we have some of the most incredible minds trying to understand and predict and make some difficult decisions about how to do this well. And I think, you know, as a country, we might be doing it different to other countries, but it's because we have incredible resources to lean on in making those decisions, and every nation is very different climate, different people group. So we just need to respect and have some confidence about the people who are making the decision making. It's not the politicians, it's the people who understand the research. The best thing, without a doubt, is the hand washing. Like, I really can't emphasise, the research is really, really strong that you know, every time you come home, wash your hands. Every time you go into a new situation, wash your hands. After you've eaten, wash your hands, and before you eat, wash your hands. It really is a robust way to reduce transmission. And then the next step is that at the moment, again, we're on the 16th of March, and the advice is that if you start to cough or have a fever, is that you self-isolate for 7 days, because then you're not going to be coughing on everybody and being on the bus and what have you and passing that on. So I think respecting that and following just those two things would have a profound effect around transmission. It really concerns me. Like, I understand the importance of self-isolation, and I can even understand that request that the government are making for over 70s to self-isolate, but we do know that loneliness is an incredible driver of disease, and we do know that at the moment, you know, 1 in 4 adults have sought help for their mental health over the last 12 months, so we know that we struggle as a nation with our mental health. And so I think we need to be creative about, you know, what we do in our self-isolation. Just because we self-isolate doesn't mean we need to disconnect. And the beauty of, you know, our phones and iPads and FaceTime and Skyping is that we can maintain a connection. And I think also planning for that time, all those things that we never get round to, the photo albums and the jigsaw we never finished and the craft project and having a go at some batch cooking and, writing some cards and some emails and seeing it as a productive time where actually you can get a lot of stuff that you haven't had the opportunity to do. As well as, like, it doesn't mean you can't go outside in your garden, getting in your garden, have some seeds delivered, learn how to grow spinach for the next 4 months. It will do your gut health and nutrition a great benefit. Get some bulbs delivered and plant those. And I just think, like, we don't have to kind of hole up in our in our bed and stick our head under the duvet and feel sorry for ourselves. Like, we can do this together. So just to explain, like, our immune system is like our army, and we all have it, and there's different parts of the army that do different jobs, and it all works together to deal with infection that we are exposed every minute of the day of our lives. Like, it is there constantly working, and so at the moment, we don't have any treatment for the coronavirus. Even if you go into hospital, it's just supportive treatment while your immune system, your own body's defense, fights it off. And what happens, like, is that when you're exposed to this new virus and the body doesn't recognize it, it, number one, highlights that there's something new that's invaded your body, and number two, it's an enemy, and number three, it then starts doing this thing where it starts creating loads of little soldiers that can then start getting rid of the virus. And so that's what our immune system is doing to get rid of corona. Now, the strength of our immune system depends very much on age. So our immune system, our army, is a bit weaker as we get older. That's why the elderly are more at risk of getting poorly. Or if you're on drugs that suppress your immune system, or if you have other conditions that suppress that army, then it can't respond as well. And that's why you're likely to get more sick. But the wonderful thing is there's so much we can do to strengthen our army. So many really common sense, basic things that we can do to increase its resilience. And that comes down to sleeping well. It comes down to eating a whole food diet with lots of different coloured fruits and vegetables, and getting sugar and processed food out of our diet. It comes to moving, so actually when we're out, we're walking or running or doing exercise, or if you're indoors, doing exercise on an app, then that also boosts your immunity. It comes to aggressively tackling stress. Stress massively impacts your ability to fight infection. It's just irrefutable. So learning how to de-stress, to relax. And then finally, we know that disconnection, loneliness, also suppresses our immunity, so staying connected. So those 5 things, sleep, rest, nutrition, movement and connection, we can work on those things every day, and we can make these little decisions that will boost our ability to fight that infection, and so that we don't get ill with it. If we looked at sleep to begin with, for a lot of people, they just don't understand how important sleep is. And so to be getting 7.5 to 9 hours asleep, not in bed, for some people it's just prioritising it. They just need to go to bed earlier, they just need to turn off the TV, and they need to get to bed and get some sleep. For a lot of people, sleep's an issue. It's like, great, but I can't sleep. I'll go to bed and I'm wide awake, or, especially with the elderly, they struggle more with their sleep. And if that's the case, there's this thing that I talk about called sleep hygiene, which is just, again, some common sense things that we can do, getting caffeine out of our diet. So, coffee, tea and, Coke and what have you. It's about getting screens out of our evenings, so a couple of hours before we go to bed, just getting off our screens. It's getting some daylight in the morning. It's about de-stressing. It's about getting a little bit of exercise. And as we do those things and create a pattern of sleep, we can start to get good sleep. So for some, it's just, prioritising it. For others, they need to work. I am one of the people that has to work hard at my sleep. As soon as I'm stressed, I don't sleep, so I have to work hard. Then, you know, if we were to look at the nutrition piece, I want to say the best thing that we can do as a nation is get processed food out of our diet. If you look at it and you think it doesn't look like the plant or the animal or whatever it came from, then I would suggest you don't eat it. You know, when it's been through the factory, they've altered it and added the additives and the sugar and all of the salt and what have you, it's just destroying our gut health, which is really important for our immunity. So more, you know, before we do anything fancy, just trying to get back to, you know, a whole food diet. What were your great grandparents eating? Eat what they ate. Honestly, we would reverse so much disease, not just boost our immunity. But anyway, and I think as well as that, just thinking about eating a rainbow of colour, because it's got all of those nutrients and important chemicals that help our immune system do its job. So think colour, you know, and mixing it up, and not Skittles. We're talking vegetables and fruit here. So that's sleep, that's nutrition. You know, stress, it's just about stopping. You know, it's about resting. It's about what makes you feel alive, what makes you feel good. And that's very different. Like for me, I need to go and be on my own. I need to get into nature. I need to breathe. I need to read. But for some others, it might be actually they need to be with people, or, you know, they need to go climb a mountain, or, you know, it's very different. Or, you know, and others it might be doing a jigsaw, or others it might be writing. And so it's very unique what helps you reset. But you know what resets you. The internal chatter stops. You find some internal quiet. And so it's prioritising that, you know, in our day-to-day life, but also in our week, setting aside time that really restores us. I think the connection piece, again, it's about stopping, it's connecting with ourselves. It's about prioritising, not just chatting with everybody, but meaningful relationships. And then the movement piece, you know, you do not have to be going to the gym. It's just about walking. It's just about moving. It's just about walking instead of taking the bus. It's and then, you know, if you're self-isolated, you could download an app and do something on that too. It's just about getting more active. In order to answer that question, first of all, how dangerous is it? So it is not at the moment dissimilar to the flu in terms of the mortality, so how many people it kills. So every year we have on average 17,000 people in the UK die from flu. And again, in terms of how sick, that percentage of how many people it makes sick, it's not dissimilar. And it's not like something like Ebola, where it's getting all of the healthy and the sick. It's, you know, it's not like the SARS virus that had a 10% mortality rate. Now, it's serious because none of us have immunity. And if we all get sick at the same time, there isn't the health facilities there to nurse us and help us get better, and people who would have got better won't have access to that and will die unnecessarily. That's why we're trying to, they talk about flattening the curve. It's all about trying to distribute how quickly it spreads, because everybody will get it in some form, but it's so that the health service can cope and give you the care that you need should you get sick. So I think one of the things that I feel when I'm talking to the people, if I feel there's this fear that if they get it, they're going to need ventilation. And that's not the story. It's, you know, and I don't want to downplay it where it's like, well, everybody gets flu, because the issue is if everybody gets it, everybody gets sick. So it's trying to keep that balance. Now, will it change? Yes, most likely, but we've got researchers around, you know, the government has just put £75 million aside to research this virus. And we have people doing these jobs on the flu all the time, watching it change, creating new vaccines, you know, and monitoring all sorts of viruses that we are constantly exposed to and trying to keep ahead of the game. And I'm sure, you know, it's out of my expertise, but I imagine the coronavirus is no different. It probably will change. But we have, we have people looking at this and they're on it and they will be monitoring it. And could it get more dangerous? Then, well, in a way, the more we get immune, we won't see that thing where everybody's getting sick at the same time. Yeah, I think that's a really good question. And I think we need to understand that what we're hearing from the politicians and hearing from the government, is not a political thing. Like, the people that are making the decisions around this are very experienced, very well established scientists who are experts in their field, and they are constantly kind of modelling and mapping different scenarios and collating all of this information that's coming in from on a daily basis. And they're working with scientists in China and Italy, and everybody's sharing information in order to create what's best for this nation, which is going to be different from other nations. So I really do feel like we can trust the information that's coming up from that top end in terms of what the best plan is for us as a nation over these next weeks and months as we walk this through. It is going to be tough, whatever. Like, there is no scenario that is going to mean that everything's going to be okay. You know, we are going to lose people we love, and people are going to be sick. But in terms of reducing the impact on families and friends and communities, I do think we need to be listening to what these scientists are saying, because they have the most experience, way more than me. I'm looking to them and looking at the decisions they're making, and I'm guided by them. So certainly we worked in Sudan when there was the crisis in Darfur, and a lot of people had to move and flee their homes, and we would see outbreaks of all sorts of infectious diseases. And we would work with people like the WHO, who would be monitoring things, and then we would be involved in responding to help treat the sick, but also prevent further transmission. And that might be setting up clean water, that might have been setting up safe places where people could go to the toilet, that might have been coming in and doing an immunisation programme. But yeah, these kind of things are going on all the time, that we're doing these kind of things all over the world.
In terms of, the first one you'll probably say is wash your hands. What do we do to stop spreading it? What's the best method of approach?
I think the transmission bit, the best thing, without a doubt, is the hand washing. Like, I really can't emphasise, the research is really, really strong that you know, every time you come home, wash your hands. Every time you go into a new situation, wash your hands. After you've eaten, wash your hands, and before you eat, wash your hands. It really is a robust way to reduce transmission. And then the next step is that at the moment, again, we're on the 16th of March, and the advice is that if you start to cough or have a fever, is that you self-isolate for 7 days, because then you're not going to be coughing on everybody and being on the bus and what have you and passing that on. So I think respecting that and following just those two things would have a profound effect around transmission. I think my answer to that question is we're all in this together. It is scary, you know, and we need to hold that, you know, together, and we've got to walk through it. But two things: one, you know, we do need to think about the transmission and the hand washing, and I think there are things that we can do to boost the immunity of us as individuals, families and communities. And there are stuff that we can do in our individual choices to help weather this better. But the big thing is we're not alone. Like, we're all in this together, and we have to get through it as communities and as a nation.